My name is Alberta Edgecombe. I'm a nursing officer to community health nurse, RN, and midwife in charge of the Central Andros Health District. Well, as it relates to stigma and HIV in our community, initially, like about 15 years ago, it was a taboo. Everybody tried to down you, stay away from you, scorn you. But because the country is so small, people are related to each other, and they realize they have to help family members and stuff like that, it's not as bad as it used to be. So people are more accepting and more helpful. How often do I see HIV in patients? Well, on the island, it's not so frequent. Normally, we get referrals from Nassau. So right now in Andros, in my district, we probably have a total of about 8 positive cases. Okay, treatment for HIV/AIDS in positive patients, like I showed you before, we use the levetiracetam, and this is giving on, depending on their T-cell count. They're seen by the doctor, and so, some people are resistant to certain drugs, so sometimes they have to vary the treatment. But normally persons are much adherent to it, and when they get depressed or tired of taking the medication, they'll come in, have a little chat with me, we talk about it, and they're a little bit motivated, and then they go home and they try again. But I try to encourage them to keep up with their treatment and also their blood count. Well, treatment in the Bahamas is free to all clients because we realize it's a drug that's very costly, but because we have relationship with PAHO and all of these supporting agencies worldwide, they give us medication at a very low cost so that then we are able to give it to the clients free. There's a clinic in North Andros, Nicholstown Clinic, and they service the population down there. The population down there is like about 3,500. Up here it's like about 2,500 to 3,000. It can fluctuate during the winter season when you have guests in and stuff like that. But no, and each island is a replica. It's very difficult for the Bahamas government to try and treat the islands because it's like 18 islands that are populated, probably a little bit more. And so all the persons need health care equally, not just Nassau. So they try to duplicate health system throughout the country. So every island has a clinic, some of them more than others, depending on the population. If they're taking their medication, it could be years. If they're not, then it's much quicker. So I can't really put a time frame on it as such. But I've seen persons who have tested positive still haven't developed AIDS, and that's been like 18, 15 years. Then I've seen persons who, when tested, like in denial, refused to go to treatment, and within 3 to 4 years of diagnosis, they are dead. So it all depends on how compliant and how early they're tested and diagnosed. It depends on what stage they're in, because they really don't want to be in Nassau, but if to the point where they are bedridden, they need drip up and constantly being monitored, then yes, we'll have to send them into Nassau. We had a few cases like that, and they would sign themselves out of hospital and then come back here. We'll try and work with them at home as best we could, and but if it's really bad, then they really have to be nursed in hospital. A lot of skin infections, not much TB, but we're constantly observant for TB, and we do man-tool screenings on a regular basis for a person seeking job employment. I know we do mimic a lot of your treatment, because a lot of our support and donations come from the U.S. as regards to HIV/AIDS, and so we try to maintain a high standard That's approved by, the international body of healthcare, whatever that standard is. We follow that same protocol. Yeah.
Just bless every nation. From creation, God bless